Amid the emotional roller coaster of trying to conceive, couples often turn to invasive tests, expensive treatments, or assisted reproductive technologies, sometimes without ever realizing that a quiet, correctable deficiency in vitamin B12 could be standing in the way of pregnancy. Although folate's importance for fertility and healthy fetal development is well known, the equally critical role of B12 remains underrecognized, even among fertility specialists. Yet mounting research and clinical experience show that B12 deficiency can disrupt key steps in both female and male fertility, making it a hidden barrier to conception and a silent contributor to unexplained infertility. In women, B12 is essential for the methylation processes that support regular ovulation. Low B12 levels can cause anovulatory cycles or irregular periods, undermining the timing and consistency needed for successful conception. This is particularly concerning for women with risk factors for B12 deficiency, such as those with vegetarian or vegan diets, gastrointestinal disorders like celiac or Crohn's disease, or long-term use of acid-suppressing medications, who may not show classic signs of deficiency, yet struggle with subtle hormonal imbalances that disrupt reproductive cycles. Beyond ovulation, B12 influences the uterine environment during implantation. As a critical cofactor for DNA synthesis and cell division, B12 supports the rapid growth of the endometrial lining, preparing it to receive and nourish an embryo. Deficiency may lead to a thinner or less receptive endometrium, increasing the risk of implantation failure or early miscarriage. Research suggests that women with low B12 are at greater risk of recurrent pregnancy loss, often without other identifiable causes. In men, B12 plays an equally vital but often overlooked role in sperm health. Studies have linked low B12 levels to reduced sperm count, poor motility, and abnormal morphology, all factors that impair the ability of sperm to reach, penetrate, and fertilize an egg. B12 supports the methylation of DNA during spermatogenesis, ensuring the genetic integrity of sperm cells. Insufficient B12 can contribute to DNA fragmentation, raising the risk of infertility or early embryonic loss. Remarkably, supplementation with B12 has been shown in some trials to improve semen parameters in subfertile men, offering a simple, low-risk strategy to boost natural conception chances. What makes B12's impact on fertility so mysterious is that standard fertility workups rarely include B12 testing. Couples may spend months or years and thousands of dollars on interventions without anyone considering a nutritional cause. Even when B12 levels are tested, normal serum levels may mask functional deficiencies that interfere with methylation and DNA synthesis, especially in individuals with subtle absorption issues or genetic polymorphisms affecting B12 metabolism. Yet the hopeful side of this hidden fertility factor is powerful. Restoring B12 sufficiency can be simple and transformative. For many couples, correcting B12 deficiency through diet or supplementation can normalize menstrual cycles, improve egg quality, enhance endometrial receptivity, and boost sperm health, dramatically improving the odds of conception naturally or increasing success rates with assisted reproductive technologies. Ultimately, vitamin B12's quiet but profound role in fertility is a reminder that healthy conception depends on more than reproductive organs. It requires a finely tuned biochemical balance that supports the creation and nurturing of new life. By bringing this often overlooked factor into the spotlight, couples and clinicians gain a vital tool to overcome unexplained infertility and build the families they dream of, with a solution as simple and accessible as a vitamin.